What if your feet were trying to warn you about a blood sugar problem, but you simply didn't recognize the signs? A little numbness, a strange burning sensation, swelling that keeps coming back, changes in your skin, or a small wound that just doesn't seem to heal. These symptoms can have many different causes, but some may deserve more attention than you think. In this video, we're going through 9 warning signs in your feet that could be associated with diabetes, and the final few are signs you definitely don't want to ignore. So stay with me, because knowing what to look for could help you recognize a potential problem earlier. Why your feet matter. Your feet may seem far removed from your blood sugar, but diabetes can affect several systems throughout the body, including the nerves, blood vessels, skin, and the body's ability to heal. That's why certain changes in your feet can sometimes provide important clues that something may need to be checked. Sign number 1. Sign number 2. Burning or unusual foot pain. Sometimes the warning isn't numbness. Sometimes it's the complete opposite. Your feet may start sending you sensations that feel unusual, uncomfortable, or difficult to explain. You may notice a burning sensation in your toes or the bottoms of your feet. It might feel like your feet are unusually hot, even when they're not. You may experience a sharp shooting pain, a prickling sensation, or even a strange electric-like feeling that seems to travel through your toes or feet. And for some people, these sensations can become especially noticeable at night. You're lying in bed, trying to relax, and suddenly your feet start burning, tingling, or hurting for no obvious reason. You may move your feet around, you may change position. You may even get up and walk around for a few minutes, hoping the sensation will disappear. But then it comes back. So what's happening? One possible explanation is irritation or damage involving the nerves. Remember the nerves we talked about in the previous section? They're responsible for carrying messages between your feet and your brain. When those nerves become irritated or damaged, they don't always send normal signals. Instead, they can sometimes send false or distorted pain signals. Your brain may receive a message that feels like burning, stabbing, tingling, or electrical pain, even though there isn't an obvious injury causing it. And that's an important distinction. Think about it this way. If you accidentally step on something sharp, there's an obvious reason for the pain. You can look at your foot and often find the problem, but nerve-related pain can be different. You may look at your foot and see nothing unusual, yet the sensation can still be very real. That's why persistent burning or unexplained pain shouldn't simply be dismissed as getting older or having tired feet. At the same time, burning feet do not automatically mean diabetes. There are many possible causes of foot pain and burning sensations. That's why the pattern matters. Pay attention if the sensation is new or unusual for you, happening repeatedly, becoming more intense over time, interfering with your sleep, associated with numbness or tingling, or occurring alongside other changes in your feet. And here's something many people don't realize. You can experience both numbness and pain at the same time. Sign number 3. Cuts, blisters, and sores that heal slowly. Now let's talk about something that can look incredibly small at first. A tiny cut, blister, or sore on your foot. You might notice it after wearing a new pair of shoes. Maybe there's a small blister on your heel. Maybe you accidentally scratch your foot. Or perhaps you develop a little sore from repeated pressure or friction. Normally, your body has an impressive ability to repair minor injuries. A small cut begins to close, the irritation gradually settles down, and after some time, you may barely remember it was ever there. But when a wound doesn't seem to be healing normally, that's when you should start paying closer attention. For people with diabetes, persistently high blood glucose can contribute to problems involving nerves, blood vessels, and the body's ability to fight infection and repair damaged tissue. And when these factors come together, even a relatively small foot injury can sometimes become more difficult to heal. Here's why this can be easy to miss. Imagine you get a small blister from your shoe. At first, it doesn't seem like a big deal. You keep wearing the same shoes, you continue walking. The same area keeps getting pressure and friction. But if you also have reduced sensation in your feet, you may not feel the irritation as strongly as you normally would. So the injury continues getting worse while you're barely aware of it. That's why checking your feet regularly can be so important. You can't always rely on pain to tell you that something is wrong. So what should you actually look for? Pay attention to a wound that doesn't appear to be improving, remains open, keeps becoming irritated, becoming increasingly red, starts swelling, feels warmer than the surrounding skin, produces drainage, develops worsening pain or tenderness, or changes noticeably instead of gradually improving. And remember, a wound doesn't have to be large to deserve attention. A small opening in the skin can provide an opportunity for bacteria to enter.
That's particularly important when there are other risk factors affecting sensation, circulation, or healing. But there's an important distinction here. Having a slow healing cut does not automatically mean you have diabetes.
Sign number 4, dry and cracked skin. Now let's talk about a foot problem that many people see as nothing more than a cosmetic issue. Dry, rough, cracked skin. Maybe your heels feel unusually dry. You notice white, flaky skin around your feet, or you see small cracks developing around the edges of your heels. You might simply apply some lotion and move on. And in many cases, dry skin really can be caused by something simple, like cold weather, frequent bathing, harsh soaps, or naturally dry skin. So why are we talking about it in a video about diabetes? Because when you have diabetes, changes affecting the nerves, circulation, and skin can sometimes make foot problems more important to pay attention to. And there's one part of cracked skin that matters more than how it looks: the crack itself. Your skin is one of your body's natural protective barriers. It helps keep bacteria and other irritants from getting inside. But when that skin becomes severely dry and starts cracking, those cracks can create small openings in the skin. And once the protective barrier is broken, there's an opportunity for irritation or infection to develop. Think about your heels. Your heels deal with pressure every time you stand or walk. If the skin becomes very dry and thick, it can lose some of its flexibility. Then, with repeated pressure, the skin can begin to split. At first, the crack may be tiny. You might barely notice it. But if it becomes deeper, painful, red, swollen, or starts producing drainage, that's no longer something you should simply treat as dry skin. And there's another reason this matters. Remember the numbness we discussed earlier? If someone has reduced sensation in their feet, they may not notice a painful crack as quickly as someone with normal sensation. They might continue walking normally. The skin continues to split, and the problem may become worse before they realize what's happening. So what should you look for? Pay attention to very dry or rough skin, deep cracks around the heels, bleeding from cracks, redness around a cracked area, increasing pain or tenderness, swelling or warmth, drainage, cracks that aren't improving. And here's an important practical point. Moisturizing can help dry skin, but you need to do it correctly. Sign number 5, unexplained swelling. Now let's talk about another change that many people notice in their feet but don't always take seriously: swelling. Maybe your shoes suddenly feel tighter than usual. Your socks leave deeper marks around your ankles. Or by the end of the day, your feet look noticeably puffier than they did that morning. Sometimes, mild swelling can happen for completely ordinary reasons. You may have been standing for hours. You may have been sitting for a long time. You may have eaten a particularly salty meal. Or your feet may simply feel swollen after a long day. So seeing swollen feet does not automatically mean you have diabetes. But persistent or unexplained swelling is something worth paying attention to, especially when it appears alongside other changes. So why are we including swelling in this video? Because diabetes can be associated with problems that affect the blood vessels, nerves, kidneys, heart, and other systems involved in fluid balance and circulation. In some people, these problems can contribute to swelling. But the key word here is can. Swelling has many possible causes. That's why you shouldn't look at swollen ankles and immediately conclude, I must have diabetes. Instead, ask yourself a few questions. When did the swelling begin? Is it happening repeatedly? Is it getting worse? Does it affect one foot or both? Does it improve after resting or elevating your legs? And are there other symptoms happening at the same time? For example, swelling accompanied by a wound, increasing redness, warmth, drainage, or significant pain deserves more attention than simple swelling after a long day on your feet. Here's a simple scenario. Imagine you normally put on your shoes in the morning without any problem, but over the past few weeks you notice that by evening your shoes feel much tighter. You take your socks off and see deep marks around your ankles. At first you think, I was just on my feet all day. Then it happens again tomorrow, and again the next day. That's when it becomes something worth discussing with a healthcare professional.
not because it definitely means diabetes, but because persistent, unexplained swelling deserves an explanation. Pay attention to these patterns. Swelling that keeps coming back. Swelling that doesn't improve as expected. A noticeable increase in swelling over time. One foot or leg becoming significantly more swollen than the other. Swelling accompanied by redness or warmth. Swelling around an existing wound. Swelling combined with significant pain or other new symptoms.
Sign number 6, changes in skin color or temperature. Now, take a moment to look at your feet. Not just at your toenails, not just at whether they're clean. Look at the color of your skin. And then think about how your feet actually feel. Are they roughly the same temperature? Do they look similar from one side to the other? Because sometimes a noticeable change in color or temperature can be a sign that something needs to be checked. For example, you might notice that part of your foot looks unusually red, or perhaps the skin looks much paler than you're used to. In some situations, the skin may appear bluish or grayish. You may also notice that one foot feels noticeably colder than the other. Now, don't panic if your feet look slightly different after you've been outside in cold weather or after you've been exercising. Temporary changes can happen for many completely normal reasons. The important thing is to recognize new, unusual, persistent, or significant changes. Why can color and temperature matter? Your feet depend on healthy blood flow to deliver oxygen and nutrients to the tissues. When circulation is reduced, the skin can sometimes look different or feel different. And diabetes can increase the risk of blood vessel problems over time, particularly when blood glucose levels remain poorly controlled. But again, this doesn't mean every color change is caused by diabetes. There are many possible explanations. That's why the pattern and the other symptoms matter. Here's a simple comparison. Imagine you look at both feet at the end of the day. Your left foot looks normal, but your right foot looks noticeably pale, feels much colder, and has developed an unusual sensation. That's a change you shouldn't simply ignore, especially if it appeared suddenly. Now imagine another situation. You've been outside on a cold winter morning. Both feet feel cold. You come indoors, warm up, and your feet return to their normal appearance and temperature. That's very different. The context, duration, and severity matter. So what changes should you watch for? Look for new or persistent redness, unusual paleness, bluish or grayish skin, a noticeable difference between your 2 feet, one foot feeling significantly colder than the other, a sudden change in skin appearance, color changes accompanied by pain or numbness, color changes around an existing wound. And there's one combination you should take especially seriously. A sudden change in color or temperature together with severe pain, numbness, or a very cold foot. That can indicate a potentially serious circulation problem and needs prompt medical assessment. Don't simply massage the foot and wait several days to see what happens. Get medical help. Sign number 7. Repeated blisters, calluses, and pressure spots. Here's something many people deal with and simply accept as part of wearing shoes. Blisters, thick calluses, and painful pressure spots. Maybe your shoes keep rubbing the same area. You develop a blister on your heel every few weeks. Or you notice a thick patch of hard skin underneath your foot. You might think, that's just what happens when you walk a lot. And sometimes it really is just friction or pressure. But when the same problem keeps coming back, especially in someone with reduced sensation, it deserves a closer look. Think about what happens when a shoe doesn't fit properly. Every time you take a step, the same area of your foot experiences pressure or friction. Normally, your body gives you a very simple warning. It hurts. You feel discomfort. You stop. You adjust the shoe. You put a bandage over the area. That pain is actually useful because it's telling you to protect the tissue. But what happens when you can't feel that warning as well as you used to? A small pressure spot can continue getting irritated. A blister can become larger. A calluses can become thicker. And you may keep walking normally because you don't realize how much damage is occurring underneath. That's one reason reduced sensation can make foot problems more difficult to notice. So what should you watch for? Pay attention to blisters that keep appearing in the same location,
thick or rapidly developing calluses, areas where your shoes repeatedly rub, red pressure spots, painful areas under the ball or heel of the foot, skin that looks irritated after wearing certain shoes, wounds developing underneath or around a callusize. And here's an important habit. Don't just look at the top of your feet. Check the bottoms. Check your heels. Look between your toes. And pay particular attention to the areas where your shoes make contact. If it's difficult to see the bottom of your feet, use a mirror or ask someone you trust to help you check. Now, let's talk about footwear. Your shoes should give your feet enough room to move without squeezing your toes together. They shouldn't repeatedly rub the heel or press hard against one particular area. If you consistently develop a blister in the same place, don't simply keep putting a bandage on it and wearing the same shoes. Ask yourself, why does this keep happening? Is the shoe too tight? Is there a seam rubbing against your skin? Is the sole providing enough support? Or has your foot changed in a way that's creating a new pressure point? Sometimes solving the pressure problem is just as important as treating the blister itself. And if you already have diabetes or reduced sensation in your feet, be especially careful about trying to remove thick calluses yourself with sharp blades, razors, or other tools. A small mistake can create an open wound. If a blister, callusis, pressure spot, or wound keeps returning or isn't healing normally, it's better to have it assessed by a healthcare professional. Here's the bigger lesson.
Sign number 8, repeated foot and fungal infections. Now, let's talk about another problem that can be easy to dismiss. Repeated foot infections. Maybe you notice itching and peeling between your toes. Perhaps the skin keeps cracking. You develop what looks like athlete's foot. Or your toenails repeatedly become thick, discolored, brittle, or difficult to manage. Sometimes these problems are simply fungal infections, and fungal infections can happen to anyone. So just having athlete's foot or a discolored toenail does not mean you have diabetes. But if you're dealing with repeated, persistent, or difficult to manage infections, it's worth paying attention to the bigger picture. Why? Because diabetes can affect the body's ability to respond to certain infections, particularly when blood glucose levels are poorly controlled. And when reduced sensation or circulation problems are also present, a small skin problem can sometimes become more difficult to notice or heal. Think about a simple example. You notice some itching between your toes. You scratch it. The skin becomes irritated. Then it cracks. You keep walking around normally. If sensation is reduced, you may not realize how much the skin has deteriorated. That broken skin can provide an opportunity for infection to develop or spread. That's why you shouldn't simply ignore recurring problems. Sign number 9, toenail and foot changes. Your toenails may not seem connected to your overall health, but changes in your nails and the shape or structure of your feet can sometimes provide useful information. You may notice that a toenail becomes unusually thick. It may change color. It may become brittle or start crumbling, or perhaps one nail looks completely different from the others. Again, these changes can have many causes. Fungal infections are common. Injuries can damage a toenail. Shoes that repeatedly put pressure on your toes can also cause changes. So a thick or discolored toenail does not automatically mean diabetes. But persistent or unexplained changes shouldn't simply be ignored. Look at the bigger picture. Suppose you notice thick, discolored toenails. At the same time, you're experiencing numbness in your feet. You've developed repeated pressure spots, and a small wound isn't healing as quickly as expected. Any one of those symptoms could have a completely different explanation. But when several changes appear together, it's a good reason to talk with a healthcare professional. You should also pay attention to changes in the shape or structure of your foot. Changes in foot structure can alter the way pressure is distributed when you walk. That can create new pressure points, calluses, or areas where shoes repeatedly rub. And if sensation is reduced, you may not notice the problem until the skin becomes damaged. When to see a doctor. We've covered 9 possible warning signs, but now comes the part you shouldn't ignore. If you notice a foot wound that isn't healing, increasing redness, warmth, swelling, drainage, or signs of infection, don't simply wait for it to get better. You should also pay attention to blackened skin, a major unexplained color change, new numbness, sudden severe pain, or a foot that suddenly becomes unusually cold or pale. These symptoms can have different causes, but some may require prompt medical attention.
The key message is simple. Don't wait for a small foot problem to become a serious one. If something is new, worsening, or simply doesn't look right, get it checked. How is diabetes actually confirmed? Now remember, your feet can provide clues, but foot symptoms alone cannot diagnose diabetes. Diabetes is confirmed through appropriate blood testing. One commonly used test is the A1C, which provides an estimate of your average blood glucose over the previous few months. Another is fasting blood glucose, which measures your blood sugar after fasting. Depending on your situation, a healthcare professional may recommend additional testing. So don't try to diagnose yourself based on a symptom from this video. If you're concerned, talk with a healthcare professional and ask whether diabetes testing is appropriate for. Simple daily foot check. Taking care of your feet doesn't have to be complicated. Each day, take a few seconds to look for cuts, blisters, redness, swelling, cracks, pressure spots, and unusual color changes. Keep your feet clean and dry. Moisturize dry areas, but avoid putting moisturizer between your toes. Wear comfortable, properly fitting shoes. And if you notice a wound that's getting worse or isn't healing normally, don't ignore it. A few seconds of checking your feet can help you notice changes early. Final message plus CTA. Your feet can't diagnose diabetes, but they can sometimes give you clues that something deserves attention. Numbness, burning, slow healing wounds, swelling, color changes, repeated infections, and other unusual changes shouldn't simply be ignored. Notice the change, check your feet, and when something doesn't seem right, get it evaluated. If you found this video helpful, share it with someone who needs to know these warning signs, and subscribe for more practical health information.